Okay, and with no further ado, let's start. All right, Jess. So perhaps you wanna share with us about what do you do, why do you do this, and more
Uh,
importantly, what are some of the common causes of back pain?
okay, Ken. Thank you, Jensen, for the introduction. For those of you, if you see me for first time, I'm a physiotherapist. I fix joint pain. So the reason why we're going to talk about lower back pain is I think almost everyone will have experience of lower back pain. Yeah.
Mm,
Once in lifetime, like at least lower back pain. It's a very, very common problem, whether you do sport or not, whether you're a housewife, like everyone will have lower back pain. Yeah. So, and we normally have very common questions about lower back pain. Yeah. Okay. Some
mm.
of the common question it's like, how come when I carry things on the floor, wow, I get back pain straight away. Yeah. Got experience before or not? If you got experience before, you say one. Okay. Yeah. It's very common. But carry things on the floor and then you straight away got back pain already. Yeah. Want to pick up something, or some people just say, I just want to get up from chair. Also, suddenly I got back pain. Yeah. They feel like, wow, why me? I just want to carry a thing only. I'm not even carry something heavy. I just bend down and pick up things and then back pain. Yeah.
Mm,
And then you don't know why, don't know what's going on. Okay.
mm.
And there are people also, hey, I do a lot of funny stretches, like difficult stretches, but my back still hurt lah. Yeah.
Mm.
Why? Yeah.
Wow.
And today, yeah, our main focus today is about unresolving lower back pain. Like for example, you have the back pain, and then you keep having the back pain over and over again. And the back pain usually happen after a very simple movement, like bend down,
Mm,
driving, getting out from the bed, getting out from the car, and then you got the back
mm.
pain.
Yeah.
And like at least once a year, you get it. Yeah. Yeah. It can be very annoying lah, huh? Okay. And then some people say, hey, what I did was just jogging. I just want to lose weight and then I got back pain. Yeah. I lost a bit of weight, but I got a lot of back pain. Why? I'm trying to
Correct.
exercise. Doctor told me my weight is my body weight is not healthy and then it's causing back pain. But I feel like when I jogging also my back hurts. Okay. Yeah. There are also people like they'll complain about, hey, I go to gym, I do a lot of strength exercise for my lower back already. Hey, my back hurts even more. What's
Mm,
going on? I thought I
mm,
supposed to do exercise, but the pain just doesn't go away. Yeah. Okay. Is this sounds familiar to you? Yeah.
mm.
Is the familiar? You just say one. Yeah. Okay. Yeah. So it's very common. Yeah. And before I answer all these questions, like why I bend down, pick up things also pain, why I do a lot of stretches pain, why I do strength exercise, my back still hurt, I'm going to show you some slide. Yeah, I'm going to give you a basic concept
Mm.
about how do we actually fix lower back pain. Okay, yeah, there are a few things that you need to look at before you want to fix the pain. Yeah.
And the most common trend right now, based on what I've gained from, I'm also running my 3 days online program as well, and I get a lot of people that is wanting to join our 3 days program. And there's one thing that they keep telling me is, really, so MCO, I do a lot of HIIT training, I got a bit of pain, ayo. So I also like, okay, join our webinar today.
Okay. Remember I talked about unresolving lower back pain? Yeah, that means the back pain will keep coming back. They are your old friend. Once in a while, they will come and say hi to you. It's very frustrating. Okay. Okay. So if you're having this problem, and then this one sounds familiar or not? When you have back pain, you
Hmm.
went to YouTube and you YouTube exercises for lower back pain. You can easily find a lot of exercise from Dr. Google or Dr. YouTube. Okay, so you
Hmm.
follow those exercises, but not all the exercises helps. Yeah, some people it does help, but not everyone. If it helps, then congratulations. But it doesn't, that means you are doing something not right. Okay, so the common mistake is when you do exercise for lower back, yeah, you're doing the wrong exercise that doesn't help with your lower back pain. Okay, so the exercises that works for your friend may not be necessary works for you. Okay.
Mm.
Likewise, like the exercises on YouTube, it works for the people that put comment that yes, good exercise, but it may not necessarily work for you. Okay, so bear in mind, there is no one single exercise that can help every problem. Okay,
Mm.
so we need to find out the cause of your lower back pain, and then only we choose the right exercise. Okay, otherwise you will end up doing like tons of lower back exercise, go for a lot of massage, a lot of foam rolling and torture session, but the back pain still there. Okay, mistake number 2, you have back pain and then you went and see a doctor, or you went and see some master. And then every time you go there, you feel like, every time I go there, I receive a SOP, low back pain treatment, standard operating procedure. Like every time I go there, they do the same thing only. They don't really actually tell me what is going on, They don't really check. Like I have a very funny experience. I see a patient, and then this patient came to me, and then she said, okay, I have lower back pain. Okay, so after I asked her some question about her pain, I say, okay, I need you to take out your shirt. I have to look at your back. And then she looked at me like, what? Do I have to take off my shirt? I say, yeah, I have to
Right.
look at your back, right? I said, oh, okay. So I asked her, hey, I thought you went to see doctor before for lower back pain. Yeah? Then she said, yes, but none of them actually asked me to take out my shirt. I said, are you serious? None of them actually look at your back?
Yeah,
That
and
is very wrong. Huh?
another thing, based
Ah,
on this SOP, right? My friend last time they'll tell me, yeah, I got a bit of back sore I do my back day leg day I do a lot of HIIT training Yeah, I go to my Thai massage. Yeah, you know what
ah,
happened? One day later, wow, I cannot get up from the bed already.
So
SOP.
it's like an over massage. Okay, it's very common. Like you feel like back sore, go for massage, and then next day cannot get up from the bed. It's very painful.
Mm.
Okay, so I'm sure some of you who is listening may have this experience before. Okay, so whenever you go to any kind of therapy to seek treatment for lower back, make sure they do a thorough assessment. At least they touch your back lah, huh? They must touch your back and then find out what is wrong. Is your back stiff or not? Yeah,
Mm.
you need a thorough assessment. Okay, because without assessment, you may not know what is causing the pain. Okay, what is the root cause of your unresolving lower back pain? Why your lower back pain keep coming
Mm.
back to you?
I
Okay, yeah.
totally agree with you.
Then there are people also ask me, hey, I have X-ray, I have MRI, what? But my pain is still there. I say, yes, you had X-ray, you have MRI, yeah, you have your report, but there are so many research actually showing that the diagnostic imaging means X-ray, the MRI or whatever scan for people with lower back pain, it's unknown. Yeah, that means it's not accurate. Okay, so there are people with a lot of lower back pain. They went for a scan. The scan say normal, no problem, no problem with your spine. There are also people without lower back pain. When they go for scan, they see a lot of slip disc degeneration in the spine. Yeah. So what does this tell us? So this one is telling us the whatever you see from the scan, the MRI and X-ray cannot be used to diagnose your lower back pain fully. Yes, you need to have the imaging, but you also need to go through some physical examination for your lower back.
Mm.
Otherwise, because the imaging, the X-ray, the MRI scan is good to see whether you have maybe broken bone, maybe the disc actually compressing the
Yeah.
nerve. These are very important. But all this MRI, X-ray doesn't tell how flexible are you. Okay, they don't tell how strong is your spine. They also don't tell how stable is your spine. Okay,
Mm.
so when you go for all this imaging, it's like you take a picture. Okay, you take a picture of the person, but you don't know whether the person is actually happy or sad inside. Yeah, you can only see whether the face only. Yeah, it's like you take a picture of your spine, but you don't know how strong is your spine. You don't know how flexible.
Mm.
So if you want to know all this flexibility, strength, and stability of the spine, you need to go through physical examination. Yeah, that means you need to do some movement tests. Okay, so there are two parts of examination for lower back. One part is of course, the X-ray, of course, the MRI, and then later must do some strength, flexibility, and stability tests for the spine. Okay,
Yeah.
so bear in mind, Okay, so I also have experience where my client, they come and tell me, oh, actually I have pain in my back all the way down to my leg. I go and see orthopedic doctor. The doctor sent me for scan, MRI, but the MRI come out everything normal, but
Yeah,
I
and
still have a lot of pain. No,
this is so normal, like
it's very
whenever
common.
people with back pain, right, they'll say that, oh, should I go for MRI scan, and then it will cost so much money, right? So I was like,
Yeah.
no, just seek to a thorough assessment first to find out
Yeah. Yes. So MR is important, but you cannot depend on MRI on me. Okay, you need to combine MRI and also physical examination. Okay, and then I asked her, so what did the doctor say after your MRI scan show nothing? The doctor just asked me to go home and then I said, and then
take Panadol.
he didn't even give her Panadol lah.
Oh,
He
really?
didn't even tell her where to go, what to do, because the doctor see the scan normal, then ask her to go home only. Then she was like, hey, I'm suffering in pain, but I cannot find the cause of the pain, right? Yeah, that's very sad. Okay. So, and then later she came for a treatment, then we do some tests, and then we found out, oh, she has some muscle weakness, and then the muscle weakness is actually causing some pain around the hip and the spine. Okay. But from MRI, you cannot tell whether the muscle is weak or not. Yeah. So that's the problem. Okay. You can only do muscle tests to check the strength. You cannot take MRI to see whether how strong it is. Okay. Yeah. So her problem is actually some strength problem. So far I'm okay, right? Everyone can understand. Okay.
We're not saying that MRI, X-ray, and the doctors are bad. But even for me, I personally also had a few experience with certain practitioners whereby all they do is like, okay, you got pain, go through some kind of scanning. It's either they do exactly like what just mentioned. They will just, okay, no pain, hey, your X-ray okay, then you just leave you, or they give you painkillers. But then it will come back.
Yeah, because when we look at people with lower back pain, especially it's a repetitive kind of lower back pain, right? There must be a reason why these people keep getting lower back pain, yeah? Is it because nature of the work? And then is there a way we can modify the work? Yeah, is it because the way they move, the spines are unstable, they have some weakness issue in the spine, they did something wrongly, and they're not aware of? These are very important, especially the pain is like repetitive. Okay, it's a recurrent pain. Yeah. Okay, so when we look at our lower back pain, right, there are three things that we need to look at. Okay, so there are people where their pain is caused by flexibility issue. The muscles of their hip and the lower back is tight. Okay, so this kind of people, they'll be benefited from massages and stretching. Okay. So, but there are also people with very flexible spine. They can touch their toe, they can bend backward, but they have strength issue. Okay. So when you have strength issue, if you do a lot of stretching, it's not going to help. Okay. Because you are very flexible, and then your problem is not caused by flexibility. So you need to work on your strength instead of flexibility exercise. Okay. Because when you go Google or YouTube, right, you may not understand what are the exercises. Okay, so they will tell you, okay, 7 exercises to fix lower back pain, then you follow, but you don't know whether it's a flexibility exercise or a strength exercise. Okay, so if you're already flexible, then you're going to do all the flexibility exercise, it's not going to work. Okay, and also another one, stability. Okay, so there are people who has pain because their spine is not stable when they move. Okay, so these are the people will not benefit from flexibility and strength exercises. So they will benefit from stability exercises. Okay, so you need to look at what is causing your lower back pain. Okay, but of course there are people with flexibility or strength problem at the same time, combo problem. Yeah, so we need to do assessment. Okay, we need to check whether your pain is caused by flexibility issue or your pain is caused by flexibility issue or strength issue. Okay, so there are three main components lah. This is not the everything. Yeah, it's at least the three main thing that need to focus. Okay, so there are so many exercises available on the internet, but you need to know which are the exercises will help you. Okay, if you are doing flexibility exercise, it's not going to help you if you have strength problem. Okay, if you have strength problem, you need to do strength exercise. But actually, Jensen, do you notice there are a lot of people who cannot differentiate flexibility exercise and strength exercise?
Yeah, so I think that is why it's our role to guide them.
Yes, because a lot of time when they come to me and say, hey, I do a lot of exercise, I do a lot of stretching, but it doesn't help. So I ask them, you show me the exercise. And then sometimes they show me the wrong exercise. Okay, because they don't know how to categorize the exercise. Okay, yeah, so they do the wrong exercise for their back, and then they end up wasting their time. Okay, yeah, so you must check the cause of your back pain, and then you must choose the exercise wisely in order to see the best effect. Okay, so I have very simple tests that I normally use for people with lower back pain. Okay, so for people with lower back pain, especially if you have this problem for more than a year, and then you already have the back pain attack for at least twice, you have some muscle imbalance and strength problems around the spine and the hip. Okay, how to know whether you are strong or not? This is one of the simple tests you can do. Okay, so this is actually a video, but I cannot play the video here because the Facebook Live, if I share video and then they will cause some lagging. So I just screenshot Okay, so if you want the full video on how to do this exercise, please comment pain, PAIN, and then I will send you the full link of how to do this exercise. Okay, comment PAIN. So basically what you need is you need a chair, of course a stable chair that it doesn't move away. Okay, try to get up from the chair using one leg only. Okay, so like the picture on the left, you lift up your left leg and then use your right leg to stand up. Okay, try to do at least 5 times. Okay, see whether you lost your balance when you do the exercise. Did you have difficulty in getting up from the chair? And then do you have back pain or knee pain when you do this test? Okay, so today I have a client. He came to me and then he has this pain on left side of his back for more than 2 years already. He said like every few months my back pain will come and visit me. Like I said, oh, so what did you do normally? And then the pain will come. I did nothing. I was just getting up from the chair. Sometimes I just want to pick up something. Sometimes I just want to get up from the car and then the pain started already. Yeah. Okay. So after the assessment, I found out, I asked him to do this test and then he has a lot of problem getting up using his left leg. Okay. His pain is on his left side, always on the left side. And then I found out he has history of knee injury on his left leg. Yeah. And then after the knee injury, he did not get a proper rehab. And then his left side is very weak. And then the weakness of the leg is actually putting a lot of pressure on his back. Okay, because he cannot get up from the chair properly. He lost his balance and he even had pain when he tried to get up.
I see.
Yeah. So for those of you who is watching, yeah, you can do this test later. Yeah, just need a chair and then try to get up from the chair using one leg only. Okay, if you are not sure how to do it correctly, comment pain, PAIN. I will send you the video link on how to do this test correctly. Okay, so observe for loss of balance, difficulty in getting up, back pain and knee pain during the test. Yeah, so this is a very simple test. You should be able to do this test. If you cannot do the test properly, that means you have this is mostly the strength and stability stability side of the exercise.
And this is not an easy test also. And for those of you that's watching, there's about 25 to 30 of you. So welcome if you guys just joined in. And we're here with Jeff, and we are right now at the testing. And thereby Jeff is sharing about what tests you can do to identify back pain. Again, to the new here, to recap, number one, you have to know why you have that pain, right? You
Yes.
have to make sure you know the root issue instead of just simply going to random exercises. Okay?
Yes.
The first thing
Yes.
that Jess spoke about, and I truly agree with what Jess has mentioned, instead of just Googling exercise of back pain, which a few of people that I know have done that and they end up with more pain, and they kind of tell me, Jensen, I tried all the YouTube exercise, but it doesn't work. I said, yeah, do you know why? Are you doing that? I said, no. So number one, guys, those that are new, you need to know why are you having back pain and to get an test. All right. And this is
Yes.
the test that Jess would do. Okay, Jess. Yep.
Yeah. Okay. So if you not sure how to do, if you want a full description on the video, comment pain, yeah, PAIN. Okay. Then you will get the video link lah, huh? So okay. So in details, if you have a mirror in front of you when you do this test, you'll be even better. Okay. So if you look at the picture in A, okay. So this lady, when she do this test, the body is of course this picture don't have a chair lah, but this is just to give you a concept of what do I mean by instability of the spine. Okay, so from the picture number A, when she try to get up or squat down, the body will shift to one side. Yeah, because she doesn't have enough strength to maintain the trunk stability whenever she do movement. Okay, so when you do the test, observe yourself, see whether you do this or not, like picture number A. Okay, so like picture number B, so this guy, when he's doing the test, you can see his spine is quite straight. Okay,
Quite
we
good.
call it stable. Yeah, okay, so when the spine is stable, you don't have a lot of unnecessary movement going through the spine, so the chances of you getting back pain will be lesser. Okay, so if when you do the test, your trunk it's like unstable, like the one on the picture number A. Can you imagine when you do the HIIT exercise, you do the squat exercise, the spine is like this, and
Yeah.
of course you get back pain, no? Okay. Okay, so this is what I mean by instability. Okay.
Another issues are when I see people doing this kind of tests, and this is one of my favorite movements. It's called your single leg squat, or partial.
Yeah.
Is they just lack so much strength on the glutes, on the hamstrings.
Yes.
Yeah.
So a lot of time they don't know whether they are strong enough or not. They thought, hey, I've been doing a lot of exercise, but I do a lot of HIIT. Are you trying to tell me I'm not strong? I said, no, I'm not telling you, but I'm just showing you. Okay, you do the test, then you know how strong are you. Okay, so do the test. Okay.
Oh, just one question for you. Do we need to go all the way down now?
No lah. For the test purposes, no need. Yeah, because there are people who go all the way down, they cannot get up.
But is there a need to go all the way down? Because a lot of people I've seen doing this they go like pistol squat all the way down,
No, because like our Facebook Live today, we are going to talk about people with lower back pain. Yeah, not everyone is able to do single leg squat all the way down, except athlete. Okay, so I'm sure there are people here watching us. They are not like very, very hardcore athlete. Yeah, they may not have the strength to do that. And then if they do that, the chances of them getting injury is very high by just doing the test. So the reason why I use a chair is because I don't want people to hurt themselves when they're trying to do the test. Okay, so please do it in a safe environment. You just need to get up from the chair. Okay. Get up from the chair and then see whether your spine shifted one side, whether you fall, you lost balance and pain or not. Yeah. So of course, if you want to have further and more detailed tests, you have to consult physiotherapists. Yeah. We have more tests to check for you, but this is just one of the tests that you can do at home. Simple and safe. Okay. Okay. So now let me see. Let me stop the screen for a while before I talk further, okay? Let me answer some questions first, okay? Are there other questions for me? Let's see. Yeah.
Guys, so do prepare some of your questions so that Jess, can answer these questions, or myself can answer the questions. Today we are talking about back pain. And you can share with us how you got back pain. Like we have Chris CMC, and another one is Tan Chek Hong. So if you can be
Okay.
specific in how you get your back pain, it will help us to
Mm.
walk you through lah.
Okay, let's answer Chet Hong question first. This is the first question that I got. Okay, Chet Hong, there are many reasons why people got lower back pain after running. So number one thing is you must check your running posture. Okay, check where, because how to say, it'll be good if you can have a video of you running, yeah, and then you show a physio or coach, because sometimes when we run, right, we arch our back too much or we slump too much. That could be a postural issue when you run. Okay.
Mm,
And some people, they are trying very upright, not to slouch, then they over straighten their back. This will also cause a lot of pressure to the spine. Okay.
okay.
You need to check your posture, running posture, whether your running posture is bad. And then there are people, because when the way they run, they move their back unnecessarily because they did not engage the core muscles. Yeah. So they should be able to run with a stable trunk. Yeah. If they have good core muscles. I'm not sure whether you have seen people when they run, like you look at the way they run, you feel like these people like going to fall down anytime or not. Yeah. They are people who run and then they look like they're falling down. Okay, so these are the people who run like they do not engage the core properly. Yeah, so their legs, and that they, when you look at the way they run, it's like very dangerous lah. Huh? So must check your running posture, and then one of the reason why people got back pain after they run long distance, especially if the road is very hilly one, it could be because of the weakness of their glute muscles, hip muscles, and the thigh muscles. Okay, must check also.
Oh,
Could be
Jess,
strength.
do you have something that we can do at home? What are your favorite tool that you use to help to release some kind of back pain?
Okay. Later, let me answer Chris first. Chris, I have low back pain during plank session. Okay. Okay, Jensen, what are the common plank posture that will cause back pain?
I think before I even answer that, right? What are your thoughts on people planking for like 5-minute planking challenge 10-minute planking challenge Is it beneficial on planking so long?
It depends on the objective lah. If it's for challenge purposes, okay lah. The benefit is they feel good lah. But of course, if you want to plank for 5 minutes, you must plank in the correct posture lah. But for example, if you can plank very well for the first minute, but the later 4 minutes, the form is bad, it's poor, you are hurting yourself. So Chris, I'm not sure whether your plank posture is good. Yeah. So if you're telling me like I get lower back pain after I plank for 20 minutes, could maybe because overdo it. But if you tell me I got pain after 1 minute of plank, that means something maybe not so right with your lower back, spine, and muscles, because 1 minute is a very not so difficult task lah, huh? So if you got it at the very beginning of the plank, need to check the posture, need to check the spine as well. Okay. Yeah. So if you can tell me more information, it'll be even better. Like for example, do you get pain in your lower back in other kind of movement? Yeah. Maybe squat, you got pain or not? When you stand too long, you got pain or not? Okay. If it's just only plank, maybe it's just the posture is wrong lah. Okay.
Sim Li Fui is a client of mine. So she just recently joined my online program, I think. Li Fui. Then we also have Justin. Justin asks, is back pain and back sore the same?
Okay. It depends lah, Justin. You know, some people define soreness as pain, some people define pain as soreness. If you really want to differentiate these two, I guess back pain is at higher intensity, Yeah, it's sharp enough to make you stop doing certain thing. Back sore is like, I could feel it, but I can still carry on with the exercises. I can still carry on with my daily activity. It doesn't affect me. Okay,
But
see how you define it, and then whether you need to seek treatment or not, it depends on the intensity of the pain. And then whether you always get this pain or not. Like for example, every time when you do certain thing, you will feel this sensation one. Okay, and the intensity of the soreness or pain is strong enough to stop you from doing something, then this is the time you have to seek help lah. Okay.
and also for those that are watching, right, it's the same thing like working out. You need to know your comfort level of soreness. If you feel pain, you have to stop. Like sharp pain, maybe around 10 is about more than 5 or 6. I will ask them to stop already. But you should not do is a lot of people, their misconception, right, is I need to feel the soreness and the pump, then it's a good workout. Like you don't need to chase fatigue and soreness. The only reason you want to do it, right, is to have the sense of accomplishment towards something. But my question for you, for people that want to chase fatigue, is it worth it to potentially risk yourself to an injury, for the sake of trying to prove something for a challenge, lah. So don't chase soreness. Chase after quality and a plan.
Okay. So Gary asking, used to have back pain, few years back, see physio, drew right there, and sitting posture. Okay, so if your problem is caused by a bad sitting posture, yeah, and then some unresolving muscle tightness around the back, definitely you will benefit from dry needling and correct sitting posture. But not everyone will benefit from the same thing, okay? Yeah, so there are people with good sitting posture, they still get back pain. So that means something else. It could be like strength problem, stability problem. But anyway, congratulations, Gary. You carry off your pain already. Li Fui.
Li Fui just recently joined my online program, and I really salute Li Fui. I asked her what is her goal. She said that, okay, I want to run the Penang Bridge Marathon. Then I asked her why, and you know what? And you know what she said me? She told me, because she told me, right, because after I see people run the marathon, wow, they sweat a lot. So sure, I also want that feeling. I'm like,
okay. So Li Fui, supposedly, because there are many types of physiotherapy treatment available in the market, I'm not sure what kind of physiotherapy treatment you had in hospital and whether they actually explain to you what you're supposed to do. Yeah, whether you have flexibility issue, you have strength issue, or maybe some stability issue. So you need to find out first. But if you already have treatment for more than 3 months and yet you don't see any improvement, it'll be good if you can seek second opinion from another physio. Okay, so otherwise you can, because I can't really tell you what before I see you. Yeah, if you are nearby in PJ, you can drop by. I can have a look at you, and then perhaps you can try the test just now. I demonstrate single leg sit to stand. See whether you can do the test or not. If you cannot do the test, that means you have to work on the strength. Okay, yeah. So that's the best I can tell you here, lah, huh? Because without seeing you, I cannot tell you. Okay.
Li Fui, what you can do is when you train with me and the team, right? So do highlight this issue so that we also know what to do for you. Okay. As per mentioned, regardless of what program you do, we have to make sure that we train smartly. And even if you're injured, right? When I go to Jazz for my injury last time, I do have injuries as a coach, and I also, when I refer to Jazz some of my clients, and Jazz will tell me, okay, this person, cannot do this exercise but can do this exercise. The worst thing that one can do is to completely stop everything unless it's very bad, lah. But I think in most cases, people still can do something, right, Jess?
Yeah, you just have to avoid those activity that will aggravate your pain. Okay, so once because the reason why assessment is very important is you want to know what are the movement it's bad for this patient and what are movement is good for this patient. So you just need to focus on a good movement for them when they have the injury. Okay, because complete rest, it's may not work all the time, and then you may get the condition if you rest too much. And then it'll be very hard to pick up later. So
Correct.
you just need to find out what are the good exercise for you and what are the bad exercise you need to avoid. Mr. Paul Meng, okay, what kind of exercise to strengthen the back muscles? Okay, if you have no lower back pain issue, you just want a general back strengthening exercises, yeah. I can tell you a few, yeah, but if you have back injury, don't simply go and do, okay. Like simple exercise like plank exercises is good, the Superman exercise, and then some of the deadlift exercises with correct posture, of course, yeah, the deadlift exercises, squat exercises can help as well. Okay, yeah, squat exercise is for strengthen the leg, and your back has to be in good shape lah, in order to do it well. Yeah, so there are many back strengthening exercises and core exercises, yeah, it depends on what are the objective lah. And if you have lower back pain, you must do assessment first lah before you try any of the exercise. Okay, Gary, sleeping posture. Okay, so far there is no best sleeping posture for the spine. Okay, as long as you're comfortable, but the mattress has to be firm enough to support your spine. Okay, if your mattress is is too soft, it doesn't give support to your spine, no matter what position you sleep, it's going to cause problem. Okay, there are people who like to sleep on the side, there are people who like to sleep on the back. Yeah, okay, so if you have for example lower back pain, you can only sleep on the side, then you have to sleep on the side first. Most of the time lower back pain is not caused by sleeping posture. Yeah, it's caused by sitting posture, exercise posture, and then standing posture instead of sleeping, because when you're sleeping there's not much impact that goes to the spine. Okay, but the reason why people are very concerned about sleeping posture is they wake up with the pain, so they thought sleeping posture is the one that's causing the pain, but actually it's not true. You want to ask something, Anderson?
No, I think Li Fu has said something. So after this, right, Jess is going to show something very practical that all of you can do at home and at a minimal investment. Because you know that you can help and prevent pain at the comfort of your own home.
Okay.
And Li Fu, when I look at Li Fu, you mentioned that we always feel satisfied when we feel pain during workout. Most people always say no pain, no gain. But the main mantra, that I really believe in right now between me and Jess is the no pain, no gain mantra. It doesn't work anymore in today's, in the health and fitness and the rehab world. It's all about making sure that we do the smallest things very well. So instead of, okay, no pain, no gain, we have to do the basic. Even like when, when you ask what kind of exercise to strengthen, like just gave a few exercises, general exercises. But what you can also do is to find out, okay, what are exercises that you can do based on different angles, based on what you can do first. So these are all the deeper questions that you need someone to be here to assess you and to give you feedback.
Okay. So just now we talk about you have to do the right exercises in order to help with your lower back pain, and then before you know what are the exercises to do, you must know whether your back pain is caused by flexibility problem, stability problem, or strength problem. Okay, so now I'm going to tell you how you can relieve your pain, because now MCO it's a bit hard to go out. Yeah, some people they scared to go out as well. Yeah, so I'm going to share you some very safe method to relieve the pain. Okay, but of course it's just to relieve your pain, but you still have to find the root cause of the pain. Yeah, okay, so it may not work for everyone, but at least you are aware of there is some other option that you can use to help with your lower back pain. Okay, so I need to share my screen again. Yeah, in the meantime, while waiting for me to get my screen ready, you can put your question in comment. Yeah,
And for those of you that wants the video on how to do that single leg test that Jess recorded, so comment down
Mm,
as no pain and
mm,
just send
mm.
to you. And at the same time, if you have any questions, the good time right now to ask questions. Wow, it's already close to 50 minutes. And
Okay.
wow.
Okay. So I'm sure a lot of people is aware about foam rolling to relieve soreness in their leg, their thigh, their hip, and their other body parts whenever they feel sore after workout. Okay, so there are also people use foam roller for their lower back as well. Okay, but if you look at this picture, this lady is using foam roller for her lower back. But
Mm.
majority of people with lower back pain, they will have difficulty to get into this position. Okay, and also people with weak tummy and core muscles, they won't be able to hold this position. And in fact, based on the experience, I noticed people get injured by this kind of movement rather than getting the benefit. Okay,
Mm.
so you can use foam roller to help with your lower back pain, but you need to use the correct tool. Okay, so I will not recommend using the conventional standard size roller for lower back, because our lower back is very sensitive, and then we have bone there. If you're using the normal foam roller on it, you're going to hit the spine. Okay, and then you may cause some injury.
And
Okay.
the worst thing is, if you use a foam roller that has the spike, oh my goodness.
Oh my God.
Okay,
It may cause more pain. Okay. So for those of you, if
please
you
don't.
have not seen your spine, so this is how your spine looks like. Okay. So this is a side view. So as you can see, the spinal process is the pointy, bony surface. Okay. So imagine you sleep on the roller and then the roller is hitting the spine. And especially if you're very skinny, you don't have much fat. So it's going to cause pain, more pain to your spine actually. Yeah. So I will not recommend to use the normal foam roller to relieve back pain. Okay. Instead, I will recommend you to use a dual roller for your lower back pain. Okay. So as you can see from the picture, you can see this tool is actually made by two balls lah. It's like a peanut shape. So the cleavage in between the balls is actually designed to protect your spine, so you will not hit your spine when you roll it. Okay, so so this is how it looks like when you're using we call this dual roller. Okay, so if you are very bony, if you want to find some tools to relieve your back pain, I will strongly recommend you to use dual roller. Okay, rather than the whole foam roller that will hit the spine. Yeah. So when you are lying down on the dual roller, as you can see, the space between the ball can help to fit your spine without hitting on the spine. Okay, yeah. So this is a safer method lah, huh? Okay, and so this is how it looks like. This is how you should place the dual roller before you want to do it. Yeah, you need to make sure the cleavage is actually on the spinous process. Yeah, as you can see the boning there. So put it there, because most of the time our pain is at the side of the back. Yeah, so this is a better tool, a more effective tool for lower back pain. Okay. So how to use it? You just need to put the roller at the back, not directly on the spine. Yeah. And then you just need to do a half squat and then press your body against the ball. And then you roll up and down. Yeah. This is very simple. Okay, so you don't have to worry about, you cannot get up from the floor, difficulty to get up from the floor after the rolling session. Okay. Yeah, this is a safer alternative lah, And of course, you can use a massage ball if your pain is mostly one-sided. There are
Yeah.
people who have pain only one side, yeah. So people with pain only one side, they benefit from a ball, the normal massage ball.
Mm.
Okay, so then you can put the ball on the side of the pain. Again, not on the spine directly, yeah, because we don't want to roll your bone. Okay, can you imagine people massage you and then they hit on the bone? It's very painful, right? Yeah. So put the ball at the side. Don't put it directly on the spine, okay? It's either you can put on the left and on the right, and then half squat again. Press your body against the ball on the wall. All right. So this is a simple tool, huh? Okay. So if you find you want to try foam rolling and you're not sure where to buy this dual roller, right? Yeah, so it looks like this lah. Okay.
Yeah,
So
and
if you
watching this, Jess is giving a very, very special discount. Jess, how much are you giving?
so this one, the normal retail price is 65. Yeah. If you want to buy today, I can give you promo code. Okay, 15% promo code. Yeah. And then I'll send you the Lazada link. You can buy on Lazada. Okay. So you just need to comment. Let me see what comment what already. To send you the link. No, cannot comment. Oh, you need to comment ball, 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 okay? And then we'll send you the promo code lah. Then you can buy lah. Okay. Because buying from Lazada is cheaper.
Comment ball down below and Jess will send you promo code.
The promo code, okay? So you can try buy this and try it, and then also you can get this in the Lazada link as a promo code, okay? Comment ball, BALL. Okay, let me see. Question.
Ball.
Rose. I've been having back sore like forever. Also, you are the one that I talking about unresolving back pain lah. Acute pain attack from some wrong posture activities. I use this book. I seem to end up with more information. Okay. I need to see, Rose, I need to see how you use it. Yeah. If you overuse it, use it wrongly, there will be some inflammation and pain. Okay. Yeah. And also there are certain time you are not supposed to use it. And then there are certain time where you can use it. So a lot of people, they thought, when the pain happen during acute pain and they use it. No, you're not supposed to use it when you have a lot of pain. You're supposed to use it when you feel tightness. Yeah. Not use it to relieve acute pain. It's not suitable. Okay. It's suitable to use it when you have you feel tight. Okay. Not supposed to use when you have pain attack. Okay. And then you should not use more than 1 minute on the same spot. Yeah. Not more than 1 minute. Okay. Otherwise you end up hurting the muscles. Okay.
Yeah. All right, guys. We are right now almost an hour, and I think there is about 26 of you that's watching. And right now, let's take the next few minutes to answer questions. But at the same time, just to recap on based on what Jess has mentioned at the very beginning. Number one is to make sure we know what's the problem. Having someone to be here with you to assess you, to diagnose, and to be able to look at your movements, instead of straight away spending, on tests, MRI or X-ray. Perhaps one of the best things that you can do is to get an assessment. Right now, Jess, can you also do something for everyone here?
Do what?
Assessment for those that want to take action to go and see you for their back pain.
Then they do. I think they can comment pain. Then they comment pain. Then when they get the link, there will be instructions to get the assessment. Yeah, as well as comment pain, and then the video link, there will be some instruction on how they get the assessment.
So Rose also asked something.
Rose,
I wouldn't even recommend to go inside some more.
No. Rose, it could when you feel the soreness and tightness is very deep inside, right? It could be something else. It could be maybe the facet joint of the spine is tight. Yeah. So if it's a facet joint problem, the ball is not going to help much. Okay. Don't try to press harder to get to the inside soreness, because the soreness may not come from the muscles. So the ball, all this ball is good for soreness caused by muscles. Because Rose, I remember you have history of sleep disc, right? So if you have sleep disc, you will have more than just muscle tightness. You can have some tightness in the joint and of the spine as well. So I will not recommend you to press harder because the soreness that you feel may not be from the muscles. Okay, so please don't press harder. Yeah, especially when you have history of sleep disc. Okay, and I remember you have treatment with chiropractor and physio as well, right? You can always seek for their advice. Okay.
Okay, all right. All right, guys. It's almost 1 hour, so let's get a few more questions. But before that, right? I'm going to conclude a few things to share a few things on what Jess is giving away, and I'm also going to be doing something special for all of you that's also watching this video. So I'm quite certain that you want the assessment video from Jess. And Jess has made a pre-recorded video. You get to see her pretty face also and see her. And you get the promo code for the ball. And ever since I used that ball, I remember I bought that ball from you at your office. So you also buy the ball from your office, I just.
Who can? But now MCO difficult ma.
Yeah.
So they buy online, then let Lazada do the delivery job lor. More convenient ma. They can come to my office also.
Can. And what you see, Jess so good. Jess also give another free assessment for those of you that want for your back pain.
Walao so many things lama. Then
I want to do.
Lah.
And here's also what I'll do for you guys, because you guys stay until 1 hour, see both our face, listen to both of us talking. We're going to also give all of you our 3 days program for free. It's an online program, because there are some of you here asking about questions about strength training, about what kind of exercise that we should do. And rest assured, whatever that sometimes some of you got questions about pain, my main goal as a coach is to also help you, and to also talk to people like Jess, to ask her opinion on how we can help someone like you to not deteriorate, to not be conditioned, but at the same time to train around your injury and to get you stronger. So if you want the test video from Jess, if you want the ball promo code from Jess, if you want all from Jess, so Jess, thank you so much. And if you want,
you never give anything. Always me. How can lah?
I'll give you guys something. Okay. If you also want her free assessment, that usually costs a certain cost for her to see her for your back pain. And if you want my 3 days online program, whereby me and my team will be here to focus, on making sure that you do things correctly, to making sure that we are here to give you your progression and regression, all done online. Comment me, and me and Jess will give you all these things. So you comment down below, me, and we will give you all these things. You're gonna get
too many things, they confuse also.
You're gonna get the ball promo code, you're gonna get the free assessment from Jess, and my 3 days program.
Okay.
Mr. Stan is my client, and also Li Fu is also my regular. So Mr. Maybe you want to take Li Fu?
Sim, is it only one way to? Oh, the ball actually can be used in on your legs also. Yeah. So you can use for other body parts. Okay. If it's a ball like this, you can use for your neck and shoulder. So there are many ways to use all this ball lah. Huh?
Oh, look at me.
So, me, so funny. BMs, if I can do assessment but still cannot determine the reason, what should I do? Then you have to come and see me, okay? Because if you do the assessment, even though you managed to do the test, but it could be the way you do it is unstable, and then that means maybe you have other issues that needs to be ruled out. Yeah, so you have to come to my office or visit a physio nearby you, do a more complete test lah.
Mr. Stan, because you're with me, right? So I would recommend please go and see Jess.
BM is Mr. Stan.
Yeah, it's my client. My regular.
Okay. If you are not very far from me, then you can come and see me lah. We can have
what you can do, go and see Jess. Because you're also part of Constant, you will get also the free, and you also connect me.
Privilege lah, some privilege.
But Li Fu, because you're based in Sabah, right? What you can do is during the training program, you can also ask the coaches that is there during the online program. My 3 days. or you are already part of my online program. So ask the coaches how to use this kind of tools to help you. But first thing you may want to consider is get the ball from Jess. And then when you got the ball, ask my team to also teach you how to use the ball to help you. Okay.
And maybe Sim, if you're back, it's like, are you the one who said 3 months of physio and not better one?
Yes. Yeah.
Maybe we can consider online consultation service before you use the ball incorrectly, because I don't want you to injure because of using the ball also.
Wow, so
because I don't want him to get injured. No one seem to get injured. Huh?
So once you get the ball using just promo code.
Rose, I will talk to you later. Yeah.
So Lifo, you just tell Jess that you are with me, and then Jess will also allow us with you accordingly.
Okay.
All right, nice. Me.
Lots of me. Okay.
Okay, any other questions? And for those of you again, you want everything that of what we're giving here, just comment me. Actually,
man.
Comment just me, but now me. Okay. Yeah, but I think one of the most common things based on what I've heard recently is because there's a huge influx of people working out at home without proper guidance, and that's why getting back pain. Yeah. Yeah. Okay, and now there's 24 of you. Any other questions, or we're gonna go off pretty soon. The next few minutes. If you still want, all that we're giving you, just comment down me, and yeah, Jess and I will PM you. But any other questions?
If you're watching replay, you can still also comment lah. Yeah, because some people may miss the Facebook live.
Yeah, if you watch the replay and you want all this, you need to comment me times 4, okay?
Not so many times. Okay.
Jess, so we are going to be doing another topic next Monday, and we're going to be talking about shoulder and neck pain and shoulder issues, especially rounded shoulders. So for those watching here, I'm also quite excited to share with you about these things together with Jess. And these are very common issues that we see among working adults. Maybe Jess, you want to give a bit of teaser, a bit of this shoulder and rounded shoulder issues?
Like today, I'm going to also show you how to do DIY shoulder assessment at home. Okay? Yeah. To test your shoulder, and then is your shoulder having some flexibility issue, or is your shoulder strong enough or not? Because there are many people, right? They look flexible, but they are not flexible at certain workout and certain movement. Yeah, but they don't know why. They're very weird. They can do certain movement very well, but there are certain movement they cannot do. So I will give you the test, and then you will find out why.
Okay? And for those of you that are they're watching, so do stay tuned next Monday, the same time, the same day. We're gonna talk about rounded shoulder, and what are some common causes of why people get rounded shoulder. And even there are some cases if you don't want to look like the Hunchback of Notre Dame, that the childhood movie, the Hunchback of Notre Dame. If you don't want to look like that, then stay tuned next to next Monday. But any other questions before we go off in the next 1 minute? And for those of you that you still want your stuff from me and Jess, just comment there. Yeah, me. So thank you so much, Pei Chan, for commenting the right way. Me. Yeah.
I think.
Let's see what else. Let's see if you miss any other questions. Any knee pain life? Ayo, already gao tim already.
Knee pain gao tim liao lah.
You got a lot of injuries recently. I don't recall you having a lot of injuries. I need to find out already. Need to kena a bit from me already.
Maybe she go and do some funny exercise lor.
Yeah, I mean like, because a lot of my regulars, so I can also notice a few people here, and these are people that train with me. So that's why I was gonna a bit already. I got all this injury coming. Okay, and thank you guys for staying tuned with me and Jess. Again, I'm very, very happy to be able to deliver all these things with Jess. Stay tuned for our next talk next Monday. And if you have any questions, right, do prepare your questions beforehand, talking about either neck pain, shoulder pain, or rounded shoulders, or how any kind of pain that revolves around your shoulder part or your upper back area. Then you can ask Jess.
Okay.
And I think that's all, Jess.
Okay.
Okay, see you guys.
Bye-bye.
And stay tuned. See you guys next Monday. Okay, bye, guys.